Good day. My name is AJ Jackson. I've been working as a consultant and an analyst for a little over 32 years. My purpose on doing these webinars is to provide practice owners with enough information to make it easier to manage their practice. There's a lot of different subjects we've covered during these. I invite you to check through the various ones in the library and find the subject that interests you the most. Today, we're going to talk about treatment plan acceptance, one of the hottest issues that I run across in all my decades of doing this. Now, this is an interesting subject. On the one hand, if one can improve case acceptance, then without doing anything else in the practice, without spending any additional money, the net income of the owner goes up astronomically. So from a purely selfish standpoint, being the best at this that you can be is crucial. Second purpose is so that the patient or the client gets what they need. Third purpose is, as a doctor, you can only practice your type of medicine to the degree the patient is willing to pay for it or the client's willing to pay for it. And I've talked to so many different doctors who are just frustrated clinically because they have this ideal treatment plan they really want to have be done, but the client or the patient refuses to cough up the money to do it. And so you're compromising the delivery that you do constantly. And this really takes a toll on doctors. So there's no reason why not to get better. The patient, the client gets better. You're able to practice the type of medicine you like, and the practice makes more income. It's kind of a win-win-win. So let's take a look at treatment plan acceptance itself. And I'll tell you, by the way, I've been in this subject forever. And the way I normally do it when I work with people is I'll have them actually tape record their presentations to the patient or to the client. I'll have them, when they go over this conversation, I'll have them put a tape recorder right down in front of them and get the thing recorded. Then I have them send this to me. I have thumb drives filled with these on my computer. So I can listen to what happens. I can listen to what the doctor says. I can listen to how the client or the patient objects. And then how does the doctor handle that objection and the back and forth nature. So I have studied this stuff forever. I've gone on site into practices, posing as a patient where the doctor wasn't aware that I was a consultant. And I had him actually run his case acceptance through me as a consultant. So I've looked at this from every way possible. And in doing this for all these years, there's a few things that have come to light that seem to be universal. First, the people who actually strive to get better at this, oddly enough, are the ones who are already good at it. They're the ones that have realized there's a lot to learn, and the more they learn, the more tools they have. So I encourage you to move into that position. Second, the reason people struggle with case acceptance typically falls down onto two issues. So I'm going to walk you through those. First, this has to do with education. The main tool that let's back up. The main tool that doctors use to get patients or clients to accept the treatment is you educate the client. If the pet needs a dental, you don't tell the client to just go up front and schedule. You explain why the dental is so important. If a patient needs a crown, again, you explain why the crown is necessary. Or if you're an optometrist and you see that this person needs their glasses to be coated with a certain type of coating, you don't just tell them to go up front and get it. You explain why. All right, obviously. The idea is that if the patient only knew what you know, they're more likely to do it. This is great in theory and obviously has a lot of applicability to it. I mean, I can't argue against it. We're basically college for executives, so we're a big believer in education. But there are two fallacies with this. First, and I'm sure you've all experienced this, that you will educate a patient and then the patient will say, oh, it makes sense to me. I really want to do it, but money's tight right now. And they elect not to do it. In fact, in my discussions with doctors, almost everyone universally says, look, I can get acceptance. The only time I can't is when patients say they just can't afford it. Okay, seems logical. Except what's happening is people are buying what's called a red herring. The truth in any practice is that you will find there is a segment of the population that really cannot afford the treatment. It's food on the table for the kids or accepting the treatment plans. And you will lose every time, as you should. Taking care of the kids obviously is a higher priority. But that is a small fraction of your population base. It just seems so big because everybody uses that objection as the fallback. And let me give you an example to clarify this. You ever had a patient who said, boy, money's tight right now, and then you look out the window and you see them climb into a new car, or they're pulling out the new iPhone, or as one doctor, many doctors actually said this same example. They would say, as the patient came in, we spent about 5 or 10 minutes and he was talking about this European vacation he took his spouse on. And we were discussing it. It was all fun. And then I went over the treatment plan and the patient actually said to me, are you kidding me? I don't have that kind of money. So here, there's clear evidence that the patient does have the money. They're just not choosing to spend it. But what they'll tell you is they just can't afford it. So how do we get into this? So let's go back, first of all, to education. As I said, education is a very valid method of getting the patient to accept the treatment because you cannot force treatment on patients. They have to realize their importance on their own. So you educate them. But have you ever had this occurrence that when you're educating the patient, you feel like they've already made up their mind? You feel like you're banging on a brick wall and you can't get through to them? So I want to go over this isolated example, and then we're going to expand it greater to get into more resistance to case acceptance. So what causes this particular feature where you're walking the patient through the work and the patient, you can tell, has already decided they're not going to do it? Why aren't they listening to you? Why aren't they willing to get educated? Well, to show you what's going on, I'm going to turn you into the consumer. Let's say you have a store in town, be it a Walmart or a Best Buy or something like that. Let's say it's a Best Buy that sells televisions. And you go in, oh no, let's do it this way. You go see a movie one night and you arrive an hour early and you have some time to kill. All right, so you step into the Best Buy that happens to be next door, not because you want to buy anything in particular. Let's say you're looking at plasma TVs. You're just trying to kill time. So you're looking at a plasma TV, again, not to buy it, but just because you got an hour to wait. Now, the salesman comes over to you and, of course, says, can I help you? What do you typically say? You say, I'm just looking. It's what we all say. Why do we say that? What are we concerned will happen if we start talking to the salesperson? We're concerned the salesperson will get us to buy something we don't need or want. Okay, fair enough. So our concern is we don't want to get pulled into this conversation, so we stop the conversation from ever occurring. All right, that's our perspective. But let's look at the perspective of the salesman. If that person's good, they can size you up and go, oh my gosh, this guy's not ready to buy a television yet. But you know what I'd like to do? I'd like to educate him. I'd like to plant the seed so that maybe down the road when he's ready to buy a television, he'll come and buy it from me. So he goes down the aisle. Now notice the difference here, not to sell you something, but to educate you. But you won't let him educate you because you think he's trying to sell you something. And this conversation never gets going. He's never able to educate you because you think it's a sales conversation, and so you stop the conversation. So let's go back into the practice. Same issue occurs. Let's say I'm a patient of a dentist. Let's say I need some whitening done because my teeth are all yellow and tarnished. Well, I came in for a specific pain in my tooth. I didn't necessarily come in to get this thing handled. So let's say you're the doctor. Let's say you realize that, I'm one of those patients, you got to say several things to me over and over again before I ever decide to do it. So you're not even planning to get me to purchase the whitening products or the service. You're just trying to plant the seed or educate me. So that's your perspective. My perspective, as you start getting the mirror, showing me what's going on in my mouth, the dinginess to my teeth, I have red flags flying up. I didn't come here for this. I came in here for a specific pain in my tooth. I'm getting pulled into a direction I didn't want to get into. Here's my problem. I'm not at Best Buy. So I can't say, wait a second, I'm just looking. I can't get up and walk out on you like I can at Best Buy. I'm trapped. My only recourse, the only way to stop this conversation is I tune you out. And that's why you feel like you're talking to someone who's already made up their mind. The reason I made up my mind is I feel like I'm getting pulled into a sales conversation, and I didn't come here for that. And even though what you're really trying to do is educate me, that's not what I think you're doing. So it's this confusion between sales and education that keeps the conversation from ever occurring. So how do we solve this problem? Let's go back to you as the consumer. Let's say you've been paying attention to commercials about plasma TVs and you've gotten interested in it. So much so that you go online, maybe do a little research, have it narrowed down to a Sony or a Panasonic, but you can't figure out which is the best one. So you go back to Best Buy and you're looking at the televisions and trying to sort it out. And of course, the salesman comes over again, says, "Can I help you?" Now, what do you say? You say, "Yeah, I've kind of got this decision boiled down to what these two TVs, and I don't know which one's the better one. Can you give me some information?" All right, now you're receptive to being educated. You still may not buy it today, but you're more likely to buy it today than you were 6 months ago simply because you've been educated. And in this case, the commercials are what educated you. They gave you enough information to create some interest on your part. So how do we copycat this approach? Well, you do it by sending letters ahead of time. You take a service. So let's say you're a dentist, and maybe you take this whitening product we were talking about, or you're a veterinarian and you take dentals or geriatric programs or whatever, or you're an optometrist and you're talking about why a certain type of frame can be very effective for patients, or why lens coating is so good, or why buying second pairs is an important issue. Whatever the subject matter is, you create a series of educational letters and you send it out to the patient. So let's see what happens. Now, 6 months have passed by and we're going to have a new patient in your chair. Let's say the dentist has a patient named Mary, who, like me, has dingy teeth, and like me, the dentist has never talked with her about it. So we're very similar. The only difference is Mary's been reading these educational letters. So as the dentist grabs Mary and says, "All right, let me show you a problem here," and brings out the mirror and does exactly the same thing to her as he did to me, Mary stops him and says, "I've been reading these letters you've been sending me. I find this very fascinating. Never would have thought I could have gotten my teeth that white again. Now, I got a question. I see these kits at Walmart. Why don't I just buy it there?" All right, she still may not buy it today, but who's more likely to buy it? Her now or me 6 months earlier? Her now. And the only difference is she's had been exposed to enough education that she now has some interest. Have you noticed that it's the patients who have interest in what you're talking about, the ones that ask you questions, they're the ones more likely to buy it? That's what we're trying to create with this. So if you want to improve treatment plan acceptance, one of the first things to do is to start creating these educational letters. You can do it through mail, you can do it through email, you can do it through the website. There's different ways of doing it. Now, there's some things you have to know how to do. You got to keep the letters to a certain size. If they're too lengthy, they won't be read. You have to know what subject material to do. You have to make very sure that your nomenclature is stripped away. So there's things we always have to clean up with people, but the basic theory is create these educational letters ahead of time so when the patient walks in, they're receptive to what you're going to talk to them about and they're not tuning you out. Okay, so that's one issue. The other issue is education itself. Education exists to solve a problem, and the problem is ignorance. The patient just doesn't know why this service you're providing is important or why it's needed, and so you educate them. But there are other issues at stake that keep somebody from accepting treatment, and it's not education. Again, I offer you that example of someone that you've done a good job of educating, and they actually seem genuinely receptive to the education, but at the end, they still told you, "Sorry, money's tight right now. I just can't get it. We'll get it down the road." And then there they go, climbing into a new car or pulling out the new iPhone. All right, so what else is going on? Well, if you've inspected this as much as we have, you'll discover there are about 8 different things that will keep somebody from accepting treatment. One of them is ignorance, and that's why education is so valuable. But there are 7 other things that if not addressed, and if are an issue for the patient or the client, you'll never get them to buy it. Now, the trick on helping people through these is some of these 7 issues are a bit complex. And when we work with people on improving their case acceptance, we identify which of these issues their problem is, and we can do that by listening to these recordings. And then we teach them the techniques to solve that particular problem. And this can take the course of us actually videotaping the presentation or audio taping it and have the person doing a mock setup. And we do it over again and listen to it and watch the tape. And we do this and we spend hours on it until the person feels comfortable with their approach. Because you always have to get the doctor comfortable with how he's communicating. You cannot force a doctor into saying words that he does not believe in. So it takes a while to get it set up. So explaining these other 7 things are a bit outside the scope of this kind of webinar. Now, having said that, there is one technique I can show you because it's simple to teach and very simple to apply. So let me walk through this with you. Again, remember, each technique is there to solve the problem. So education is there to solve the problem of ignorance. This technique is there to solve the problem of what's called preconceived notions. What's a preconceived notion? It's an idea that's in the person's head before they even come in and see you. How does this play out? Well, I will give you the 2 most common ways this occurs, and then I'll show you the technique to solve it. And by the way, you've been exposed to these over and over again. And as we talk about it, I'm sure you'll conjure up many times that this has happened. The 2 biggest ways these occur are 1, someone's had a bad experience in another practice that makes them not want to accept the treatment, or someone's heard or read something about what you're about to propose that's really got them concerned. So let's take these up. I'm going to give you an example with each, then I'll give you the technique. Let's say I have a cat. Let's say my cat, let's do it this way. Let's say 5 years ago I had a cat and I brought my cat in to see the vet and my cat needed a dental. And the doctor educated me on what was going on, used his education technique. Made sense to me as the client. I said, let's go ahead and do it. And my cat died on the table. So what's the preconceived notion that gets formed at that point? Well, it is dentals kill. Now, as absurd that may seem to you, this is what's real to the client. So fast forward 5 years. I have a new cat. I've come in to see the doctor. I bring my cat in with me. And of course, ironically, what does my cat need? My cat needs a dental. And so you sit down and explain why the dental is needed. Now, I want to stop here and go over one thing. If I tell you ahead of time, now look, before we get started here, I got to warn you, 5 years ago, I had a cat and the cat died when a dental was done. Well, now I'm explaining my preconceived notion, the concern I've got about dentals. And now that it's out on the table, you have a chance to talk to me about it. Here's the problem. For everybody who's honest with you and explain ahead of time what happened, there are a lot of clients who aren't telling you this. So you don't know that this client had that bad experience. All right. So I have my cat. My cat needs a dental. You're using your education technique, your PowerPoint, your slideshow, your jump up and down, and you show them everything that needs to be done. And at the end of it, I say to you, wow, makes sense. But you know what? Money's tight right now. Maybe we can do it down the road. And so you walk out of the exam room thinking, wow, money's killing me. It's lack of money that my clients have. But is that the problem? No. And secondly, does it matter how many times you go over your education technique? Am you ever going to change my mind? No. You're solving the wrong problem. My preconceived notion has nothing to do with money and has to do with a past experience. Okay, that's scenario number 1. Let's do scenario number 2, then I'll explain the technique. Let us say before I go in and see you, my uncle comes to me. Now, bear in mind, I have not had a bad experience in another vet practice, so I'm just the regular guy. I'm going to bring in my cat. And my uncle comes over and says, oh, you're going to see a vet. Well, let me give you some words of advice. Last time I went in to see a vet with my dog, he tried to get me to clean my dog's teeth. I don't even clean my own teeth. Bunch of hogwash. Okay. So what's my preconceived notion? It's that you're going to suggest that I do unnecessary work. So I'm on guard. So I go into the clinic. I don't tell you this. And of course, what does my cat need? It needs a dental. So you're sitting there trotting out your education technique, explaining why it's so important that the teeth get taken care of. As you're doing that, what's going through my mind? Yep, the guy's a sham, just like what my uncle said. Now, I don't tell you this. What I tell you is, wow, money's tight right now. Maybe we can do it down the road. But again, is money the issue? No, it's not. Will your education technique ever work? You can keep talking about it to me every time I show up. I still think you're a con artist. And until you handle that concern, you're not going to get me to do the work. All right, so how do we solve these two problems? The answer is simple. With every new client that comes in or new patient that comes in, before you get into the treatment, you need to ask them two questions. And I would do this once I've established some good rapport. And the two questions are these. First, have you ever had a bad experience in another dental practice, vet practice, optometric practice, depending on your profession? Be overt. Ask that question. Now, when you ask the question, you need to be alert to body language because some people may be initially a little reluctant to tell you what happened, but it's all over their face. So just encourage them to explain what their experience was. Because once they've told you and it's on the table, now you have a chance to get them through it and clean up that preconceived notion. All right, once you've asked that question, then you ask the second question. Have you ever read or heard anything about veterinary medicine or optometry or dentistry that concerns you? Now, when you ask this question, you're going to need to give some examples because they may not be sure what you mean. So let's say you're a dentist. You may go, okay, are you concerned about sanitation? There was an article written in the 90s, by the way, that was trying to link AIDS to dentistry. Are you worried about any kind of treatment options? There was a Reader's Digest article that said dentists overprescribe, overtreat. Imagine what would happen if I read that one. Or maybe the patient's worried about root canals or whatever it is. You're trying to ferret out that concern. So you ask them, are you worried about sanitation? Are you worried about price? Are you worried about any kind of procedures? Get the ball rolling. Once the patient has told you, again, now you have a chance to handle that concern. All right, this particular technique I encourage you to use with every patient that comes into the practice that's a new patient. And actually, you'll find a lot of benefit by going back to your existing patients and when they come in and ask them that. All the doctors that have done this and have reported back to me have said universally either, wow, I found stuff sitting there that I never knew was there, or they would say, the darndest thing, nothing new came to light, but boy, I got in better communication with my patient by asking these questions than I ever did before. So there's no liability to this. There's only benefit out of it. All right. So if you want to improve your case acceptance, my recommendation is you really start taking a look at these 8 techniques. You've got to master these. I remember one dentist I was talking to, he said he got so good at these that the only person who gave him a trouble was people on welfare. In other words, the people genuinely who had no money. I cannot stress to you how powerful this is. You will feel very empowered being able to handle any kind of objection you've got in front of you, but it takes practice. It takes really learning these techniques, getting good at them. These are not salesman techniques, used car salesman techniques. They are techniques designed to help address what keeps a patient or a client from accepting the work. Well, I hope this has been helpful for you. If you want any further information, please don't hesitate to contact us. Our contact number is on the screen. And I wish you the best for your practice. Good day.